Right now on ABC 10 News at 4 o'clock, the surprising death of former Chargers star Vincent Jackson. Plus, the vaccination superstation in Petco Park will no longer be there come April. We take an in-depth look at what the future holds for the vaccine site. And the nonprofit stepping up to help seniors make their COVID vaccination appointments.
ABC 10 News starts now with breaking news.
Football fans are in shock today after former Chargers receiver Vincent Jackson was found dead in a hotel room in Florida. Thank you for joining us on this Monday. I'm Kimberly Hunt. And ABC 10 News Sports Director Ben Higgins is joining us now live. Tough news, Ben, for anyone who knew Jackson or rooted for him on the football field.
Yeah, the circumstances around Jackson's death remain a mystery, Kim, but people who knew the 38-year-old are remembering a rare talent and a very generous guy who had a commitment to give back to the community. Even by NFL standards, Vincent Jackson was an imposing figure as a wide receiver. 6 feet 5 inches tall, 230 pounds of muscle, made him almost impossible to cover, leading him to multiple Pro Bowl appearances as a favorite target of Chargers quarterback Phillip Rivers. Jackson was found dead in a hotel room in Brandon, Florida, where he'd apparently been living for the past month. Police spoke with him and assessed his well-being on Friday after his family had filed a missing persons report last week. There was no apparent cause of death or signs of trauma. After leaving the Chargers in 2011, Jackson went on to play for the Tampa Bay Bucks, winning the team's Walter Payton Man of the Year award for his Jackson in Action Foundation work with military families. San Diego's Kirk Morrison knew Jackson and competed against him during his NFL career.
Yeah, I think this is a tough one too because obviously he, his roots were here in San Diego, being drafted here, one of the best receivers they had for a long time. So I noticed it hits home for a lot of people.
Jackson did have some alcohol issues in San Diego with a pair of DUI arrests. Now, it's unclear why Jackson was living in the Homewood Suites Hotel near Tampa. He made over $70 million during his NFL career just in salary alone. So just a sad, sad day for NFL fans. I'm Ben Higgins, ABC 10 News.
Indeed, it is sad. Thank you for that update, Ben. And keep track of the breaking developments on this story with our ABC 10 News mobile app. We will have continuing coverage on this in later editions of ABC 10 News. We have more breaking news right now, this time in Hamul. This is a live look where the Sheriff's Department's SWAT unit is responding to a shooting on Lyons Valley Road. It's an area east of the Hamul Community Church. Deputies say a man was shot in the chest, taken to a nearby hospital. He's right now undergoing surgery. The department says the gunman has barricaded himself inside a home. Lyons Valley Road is closed in that area because of that. We have a crew monitoring the situation. We'll update you on that situation as it progresses. And now to the coronavirus. A third of San Diego County's vaccinations have been done at Petco Park, but the site is shut down through tomorrow after running out of vaccine doses due to a shipment delay. And in less than 2 months, the site will no longer be there, according to the county. As we look to answer your vaccine questions in our series, The Rollout, ABC 10 News reporter Mimi Alcala takes an in-depth look at what will happen next.
San Diego, the first county, first city to put a site together like this. Success leaves clues. You inspired others all throughout the state of California.
A week ago, California Governor Gavin Newsom praised San Diego County's vaccination efforts, specifically at the Petco Park Vaccination Superstation, the first of its kind in the state.
A third now of the vaccines in this county have been administered just here at this site. Gives you an example of the potency and power of scale in terms of the efficient distribution and administration of the vaccine.
The site has been a collaboration between the county, the city of San Diego, UCSD Health, and the Padres, giving up to 5,000 vaccine doses daily. But a viewer emailed ABC 10 News with this question. I want to know if the Petco site will be in operation indefinitely at least the next 3 or 4 months as the tiers progress and other included tiers become complete. In other words, can San Diegans rely on this site as a major player in getting citizens vaccinated for some time? We reached out to the county for answers, and a spokesperson says by April 1st, opening day, The site has to be turned over to the Padres.
We've known that Petco Park's Tailgate Park Vaccination Center won't happen forever. That's exactly why we've been standing up more locations across the city and the county.
UCSD Health confirms to ABC 10 News that they are looking at alternative sites, but right now nothing is set. There's still no word on whether the next site will be centrally located. San Diego Mayor Todd Gloria says all options are being considered.
If we need to make another city-owned property like Tailgate Park available, we'll do it. I think there are some lessons learned from Petco Park that we certainly would replicate. Partnering with a world-class organization like the San Diego Padres has been extremely beneficial. They know how to put on big events.
But Mayor Gloria acknowledges the Petco Park location also brought some challenges.
Naturally, the traffic in the area has been extremely congested.
Right now, there are 5 superstations from the South Bay to the North County. In Chula Vista, downtown, La Mesa, the Del Mar Fairgrounds, and Cal State San Marcos. They all have the ability to give thousands of vaccine doses daily as long as the supply is available. Vaccines are also given at smaller pods across the county.
I am extremely confident that we can utilize existing capacity at other locations that aren't fully used.
While it's still too soon to say, Gloria pictures future vaccination sites to include more pharmacies, senior centers, rec centers, and possibly schools.
You'll have a combination of very large-scale properties and smaller scale, all of it with the eye of just getting the vaccine out as quickly as possible.
Mimi Alcala, ABC 10 News.
And we know many people have questions and different experiences with the vaccine rollout. Our ABC 10 News in-depth team is committed to tracking down answers and sharing stories. Just send us an email at tips@10news.com. You can also head to 10news.com for more in-depth coverage on the vaccination rollout. Researchers discovered 7 variants of COVID-19 that originated here in the U.S. They say the variants each carry the same mutation, and the variants have been found in several states. No word yet if California is one of those states. Right now, researchers are not sure if the mutation makes the virus more transmittable.
The White House COVID-19 task force is pushing for more equity in vaccine distribution starting this week. It's sending doses directly to federally funded community health centers that mostly serve people at or below the poverty line. That's supplementing what state and local jurisdictions are already doing to reach underserved communities. But there's still the problem of supply and signing up.
But what didn't happen is really adequate resources to state and local health departments to actually ramp up the systems to make sure that the vaccines got into the arms of the people in their communities. And that those systems are ramping up and getting better. And I think the initial focus on really getting the vaccines into arms and doing it as quickly as possible led to some systems that aren't necessarily meant to be easily accessible by all.
Some states have been plagued by long vaccination lines, broken sign-up systems, or software that's just too difficult for many to figure out. Dr. Julie Morita says even more needs to be done to make vaccines more accessible.
So making sure the vaccines are located in clinics that are easily accessible and you don't have to have a car. Making sure that people can make appointments without having to have high-speed internet access and multiple devices. Making sure that the clinics are actually scheduled before work hours or after work hours or on weekends, so that it accommodates those people who may not have sick leave or paid time off that they can take to actually get their vaccines.
Right now, it's really not even clear how equal or not equal vaccine distribution has been. CDC data shows the agency has only gathered race and ethnicity statistics for about half of vaccine recipients.
It's been more than a month since those living and working in senior living facilities in San Diego started getting vaccinated. ABC 10 News reporter Marie Cornell checked in with one center to show us how things have since changed in those communities.
St. Paul's senior living facilities were among the first skilled nursing locations in the county to get the COVID-19 vaccine. And now, more than a month later, officials say they are slowly allowing more group interaction. ABC 10 News was there as the first resident of St. Paul's skilled nursing facility got his COVID-19 vaccine. At the time, St. Paul Senior Services had teamed up with CVS, participating in their 12-week vaccination program that kicked off in December. At the time, 45 of their residents and 95 members of their staff got vaccinated. Cheryl Wilson, who is the CEO for St. Paul's, says now all of those who wanted to get the vaccine at this facility have received both doses, which has allowed them to make some changes.
We've been able to open up communal dining again with 6-foot distancing, but people are happy to see each other across the dining table, even though they're distanced. We're also back to opening outdoor visitation. And as soon as we get clearance from the Department of Health Services, we'll be able to allow families to come in, especially families who have been vaccinated.
Cheryl says prior to their vaccine clinic, they didn't have any COVID-19 cases at this facility. And that's still the case now after the vaccines were given. Just as the latest data shows, the number of COVID-19 outbreaks in skilled nursing facilities in the county has dropped. Marie Cornell, ABC 10 News.
The Obamacare marketplace reopened today. It will be open for 3 months in order to allow people to sign up for health insurance. Applications will be accepted until May 15th. This special enrollment period is about twice as long as the traditional open enrollment that happens every year. To sign up, just go to healthcare.gov. All right, let's turn to the news feed. It starts with a drop in COVID cases in the U.S. With that said, experts say don't let the numbers fool you. The amount of infections in the U.S., it's still high. The amount of daily COVID cases did dip, though, below 100,000 for the first time in months. Some promising news about Pfizer's COVID vaccine. Israeli researchers say this vaccine does appear to reduce symptomatic COVID infections by more than 90% in the real world. That means it's showing just how effective it is outside of clinical trials. Well, new testing for younger people for the COVID vaccine. The University of Oxford is testing its medicine on kids as young as 6 years old. Researchers are hoping the study of around 300 kids at this point will help schools get back to normal.